Life-saving cancer treatment can actually lead to other chronic medical problems for survivors. But a combination of physical therapy, home exercises, and other techniques can work to keep patients well beyond a diagnosis. Doug Johnson explains.
Every few months, Amy Butler gets physical therapy at Baptist Memorial Hospital in Collierville. Her treatment is for a chronic problem called lymphedema. In her case, it was the result of surgery for breast cancer.
I had a double mastectomy, also had lymph nodes removed, and probably about 6 months to a year, I started noticing some swelling up under my arm. I talked to my oncologist about it, and he recommended that I start physical therapy.
Because she noticed her symptoms relatively early, her problem wasn't too advanced. Lymphedema is when lymphatic fluid, which carries infection-fighting white blood cells through the body to the bloodstream, is somehow blocked.
Well, lymphedema technically is an accumulation of fluid, and it is due to a dysfunction of the lymphatic system. So the fluid that accumulates is actually lymph fluid. So visually it appears like swelling.
The connection to cancer treatment is that surgery to remove cancerous tissue can also include removal of parts of the lymphatic system. That intentional damage can change the way lymphatic fluid drains.
Wherever the damage is, for instance, if someone had had surgery where they had lymph nodes removed or radiation over a lymph node area that would cause the nodes to be scarred and not function properly, then that's where you would see the accumulation of fluid.
That fluid builds up in the soft tissue of the body and can cause immense swelling in the arms and legs. The manual massage therapy that Kristen is using on Amy is one of the ways to get the fluid moving in the right direction for drainage.
The way we treat lymphedema, really the gold standard of treatment, is something called combined decongestive therapy, or CDT, and it incorporates different components.
There are 4 key components to CDT. They are manual lymph drainage, massage to move fluid toward working lymph nodes, compression to help fluid from settling in an extremity, either by using multi-layer bandages or snug-fitting compression garments, exercise that helps fluid move, and skin care, since dry, cracked skin can make the problem worse. Lymphedema patients are taught how to perform manual lymph drainage on their own, and in Amy's case, she also uses a compression sleeve on her arm, both when she exercises and when she's stuck in one position for a long time. Since lymphedema is a chronic illness, it's important for patients to manage their conditions so things don't get worse. For Smart Medicine, I'm Doug Johnson.